A team of surgeons in Kenya is giving hope and identity back to women who have undergone female genital mutilation through a process known as clitoral reconstructive surgery. The operation is, according to the doctors, expected to reduce pain and complications during childbirth and help the women feel sexual pleasure and even restore their identity, which they feel was stolen during the circumcision. The United Nations estimates that at least 3 million women are mutilated every day. And Sarah Kimani met one woman who underwent the surgery in Nairobi. We have changed her name in order to protect her identity.
Inside a theatre in Nairobi's current hospital, Agatha lies on an operation bed, ready for what she will later tell the SABC is a life-changing procedure. She is among tens of women who have come here daily for the last 2 weeks for clitoral reconstructive surgery. Here to perform the surgeries is Dr. Mercy Boaz, a US-based gynecologist, and Dr. Adan Abdullahi, a reconstructive plastic surgeon based in Kenya.
I've been doing clitoral restorations for 8 years now. My interest started in my own training 35 years ago or so, when we would see patients that were cut and infibulated even, and we didn't know what to do. I didn't know what to do. They said, leave it alone. Don't talk about it. Don't touch it. Don't worry about it. It's not important. It's cultural. I said, that's wrong. 45
minutes later, she is wheeled out of the theatre. On her recovery bed, she recounts her ordeal in the hands of the traditional circumcisers. She was only 12.
I can remember seeing many trees being pinned down. I can still remember the blade going through me. And then that was it. Then you were taken home to recover.
The World Health Organization estimates that globally, more than 200 million women in 30 countries have undergone the cut. Despite being outlawed, female genital mutilation is still practiced in Kenya. Statistics from the United Nations indicate that at least 7 million women have undergone the practice, most of them against their will. That one of the reasons why Dr. Abdullahi spent sleepless nights seeking a solution.
My community is almost 99%. Of course, education is there, anti-FGM crusaders are working a lot, but it's still happening, and it's the severe form of female genital mutilation. I must emphasize it's got nothing to do with Islam.
One thing I can say about FGM, it's something that makes you lose your dignity and your self-esteem. And I decided to do this as a gift to myself.
Medics have proven that female genital mutilation has no medical benefit to girls and women, and it interferes with the natural function of women's bodies.
Many have had problems, so medical problems, obstructed labors, bladder infections, things like that. Many have had sexual problems, so their husbands leave them or they're unfaithful because sex is not pleasing to both parties. The most important reason women seek restoration is to regain their identity.
The clitoral reconstructive surgery was developed by French surgeon Dr. Pierre Folds, the man who trained Dr. Boaz. Those who undergo the surgeries in the US pay at least $1,700 for the operation room and anesthesia. Dr. Boaz does not charge for the services. In Kenya, the women are paying just $100. Both doctors are not charging for their services.
Because of the numerous inquiries we get from ladies, we thought we should have capacity training. We have so far trained about 8 surgeons. By tomorrow, we'll probably have trained 10.
So how is the surgery done? And is it possible for the clitoris to regain its sensitivity?
The clitoris is like an ice bag. So the tip is what is cut off, and then it retracts back to the body. What we do is dissect and bring it out with its vessels and its nerves back to the surface and stitch it to the skin. And then, as has been alluded earlier on, the women feel complete.
The healing is according to the doctors fast. The women can resume sexual activity within 6 to 8 weeks. Less than an hour since being wheeled out of the theatre, Agatha is ecstatic.
I already feel different. I feel like my self-esteem has been boosted.
And when the lights go out and Dr. Abdullahi goes home?
It feels good. It feels that you've spent your day, well, certainly much better than being in a casino.
Sarah Kimani, SABC News, Kenya.